All right, here we have lesson number 24, and the topic is poisoning. Okay, so the first slide we have here is a scenario. And in this scenario, you are the emergency medical responder. Okay, so your police unit is summoned to a residence on a report of a unconscious person. When you arrive and size up the scene, you discover parents with their 2-year-old child. The mother is distraught and says she found her toddler on the kitchen floor very drowsy. She noticed that under the sink cabinet door was open, and there was an open bottle of liquid kitchen cleaner lying next to the child. She called 911 because he was not responding when she tried to wake him up. Okay, so this is a tough situation here, but remember, you always have to follow the same rules every time in an emergency. Scene safety, mechanism of injury, number of victims, additional resources. That's always going to apply to every situation you run into. You can't allow your emotions to get the best of you and you end up with several victims. So it says here there was liquid kitchen cleaner next to the child. You know, it's spilled on the ground. So do you have your personal protective equipment? This is all things you have to consider before you enter into this scenario. So now we have the topic of poison, okay? Now poison is, as an introduction, a poison is any substance that causes injury, illness, or death if it enters the body. A person can be poisoned by ingesting or swallowing poison, breathing it, absorbing it through the skin, or by injecting it to the body. Okay, toxins are poisonous substances produced by microorganisms that can cause certain diseases, but are also capable of stimulating neutralizing antibodies or toxins. Poison control centers. Poison control centers, PCCs, are specialized health centers that provide information on poisons and suspected poisoning emergencies. Okay, a 24-hour national poison helpline can be reached at 1-800-222-1222. So make sure you take that number down. Okay, save that number in your phone. How poisons enter your body. So these are the different ways how poisons can enter through your body: through ingestion, through inhalation, through absorption, or through injection. Now this is a list of ingested poisons. You have foods, bacterial food poisoning, chemical food poisoning, drugs and medications, or household items. So ingest is when you're gonna like swallow something. You're gonna, take it orally and then it goes into your system. Inhaled, okay? Inhaled poisons can be carbon monoxide. These are poisons that you don't necessarily ingest. You can breathe air and inhale these poisons. Carbon monoxide, chlorine gas, ammonia, sulfur dioxide, nitrous oxide, chloroform, dry cleaning solvents, fire extinguisher gases, industrial gases, hydrogen sulfide. Okay. Now these are absorbed poisons. Okay, we all know about, most of us know about poison ivy, poison oak, poison sumac. These are poisons that can get on your skin and your body can absorb them. Okay, dry chemicals, wet chemicals, topical medications. Okay, these are absorbed poisons. Okay, so ingested poisons. Injected poisons. Bites or stings of insects, for example, like a bee, that will be injection. Okay, they're going to inject their stinger into you and, put the poison. Spiders, marine life, snakes, Rattlesnakes, they have fangs, poisonous fangs. Drugs or misused medications injected with a hypodermic needle, okay? So an injection, whether it be through insect bite, marine life, or drugs through a syringe or some type of needle. Here's another scenario in which you are the emergency medical responder. You complete your assignment and find that the toddler is unresponsive and his respiratory and pulse rates are extremely slow. He also has some redness around his mouth and lips, and there is a strong odor of bleach. Based on your findings, you suspect poisoning, okay? So this is another scenario that we're going to talk about in class, in person. So hold your thoughts on that. Okay. So now we have administering activated charcoal, okay? So, okay. Give within 1 hour of ingestion, ideally, only if directed by medical control or the National Poison Helpline and the patient is fully conscious and alert. Keep in mind, this is an emergency medical response program. It's everything that you do on here is not for every state or entity. You do have different places with EMRs that don't administer, activated charcoal, for example. But to get through the curriculum, we still have to understand all of it. It is not for patients who have overdosed on cyanide or swallowed acids or alkalis. Mix it thoroughly with water and give through a straw or use an opaque container. Dosage is 1 gram per kilogram of the patient's weight, 30 to 100 grams for an adult, 12 to 25 grams for a child or an infant. It's unlikely we will, be administering activated charcoal, but it's part of the curriculum. Here are signs and symptoms of carbon monoxide poisoning. Dull or throbbing headache, nausea and vomiting, blush skin color, chest pain, confusion, convulsions, dizziness, drowsiness, fainting, hyperactivity, impaired judgment, irritability, loss of consciousness, low blood pressure, muscle weakness, rapid or abnormal heartbeat, shock, shortness of breath. Here's care for carbon monoxide poisoning. Ensure you are properly outfitted for safety, okay? Personal protective equipment again. Remove the patient from the situation as quickly as possible. Alert emergency department staff and physicians about the suspicion of carbon monoxide poisoning. Prepare the patient to answer questions. Inform the patient that they may have a blood test to confirm diagnosis. Monitor and treat everyone in the area of the poisoning. Administer supplemental oxygen based on local protocols. Don't forget those local protocols. Here are signs and symptoms of cyanide poisoning. Ingestion or absorption signs, okay? Dizziness, headache, nausea and vomiting, rapid breathing, rapid heart rate, restlessness, weakness, okay? Large, concentrated, intense exposure, convulsions, loss of consciousness, low blood pressure, lung injury, respiratory failure leading to death, slow heart rate. So those are more serious signs and symptoms. Now here we have the final slide, care for cyanide poisoning. Observe for signs and symptoms of cyanide poisoning. Seek medical attention immediately. Seek fresh air or rest in a half upright position. Administer supplemental oxygen based on local protocols. Wear protective clothing. Rinse eyes with plenty of water. And this is how you care for cyanide poisoning. All right, so that'll do it for lesson number 24.